I love showing this chart to patients because it does an amazing job at summarizing non-celiac gluten sensitivity, which you can see here in this column. And it looks and compares against celiac disease and then wheat allergy over in the far right. And just for fun, they put in IBS, which is a really common functional GI disorder. But what I want you to pay attention to, especially if you're trying to recover from a neurological condition, is pay attention to the colonic manifestations, meaning what's happening in your gut after consuming wheat. So whether it's celiac or whether it's non-celiac gluten sensitivity, they're almost identical. In fact, the list here is identical. Now, it's much more severe in celiac. However, the real difference comes in the extracolonic manifestations. That's fancy for things and symptoms that are happening outside of your gut. So that is tissues like the brain, it could be your thyroid, it could be your muscles, it could be your joints. I just had a patient this morning that she claims that avoiding gluten made her joints less tight, less swollen, and less painful. I hear this all the time in my patients. But just notice that things like headache, migraine, foggy mind, fatigue, myositis, which is muscle pain, numbness, and psychological changes, which is anxiety and depression, all can be related back to non-celiac gluten sensitivity. So this means that it's not celiac disease, it's not an autoimmune condition, and most likely your GI specialist has dismissed you and said, gluten's not your problem. Go ahead and keep eating it. But you may still be sensitive to this. So this is one of those examples that if you still suspect that gluten is sensitive because you just don't feel well after consuming it, talk to your naturopathic doctor to try to figure out if there is a way that this can be confirmed with a diagnosis of elimination and then reintroduction. And then also what you can do to help heal the lining of your gut to help support neural recovery.